focus of this presentation is on physical treatment strategies that can be useful in helping older adults manage pain. In this session, the learning objectives are to describe physical strategies for pain management in more detail and give examples of how some of these may be used. In Session 7, you learned about the 4 P's of pain management that include pharmacological, physical, psychological, and prevention strategies. Most individuals benefit from a mixture of treatment strategies from all 4 of these categories, regardless of whether they have nociceptive or neuropathic pain. For people who have pain amplification syndromes, more emphasis should be placed on self-management strategies that include physical, preventative, and psychological approaches. Each category offers a range of strategies that may be effective for different individuals at different times. Remember that non-pharmacologic strategies are not an alternative to pharmacologic strategies, and vice versa. All 4 categories of intervention can be used concurrently once the effectiveness of each treatment strategy has been established. Non-pharmacologic strategies may reduce medication requirements, and medication may create a window of pain relief that allows an older adult to become more active or more independent in self-management of pain. A pain-relieving strategy can be labeled a physical strategy if it is a non-pharmacologic treatment that is applied to the body tissues or engages the body in movements or activities for the purposes of relieving pain. Physical strategies can be subdivided into passive or active strategies. Passive strategies are ones that don't require exertion by the client. This includes manual therapies such as massage, joint mobilizations or manipulations, acupuncture, electrical interventions such as transcutaneous electrical nerve stimulation or TENS, and thermal agents such as warm or cold packs. Passive strategies alone may reduce pain while they are applied or for a short period of time after. And similar to many pharmacological interventions, their effects are usually not long-lasting. However, passive therapies may provide a window of pain relief to allow the individual to sleep or be more comfortable during an activity. Active strategies are ones for which the person has to perform some degree of exertion. This includes therapeutic exercises that aim to correct impairments of body functions that may be contributing to pain, such as limitations in range of motion. General physical activity participation is an active physical strategy that is important for general health and function, but can also reduce pain, improve sleep, and regulate mood. The following case scenario gives an example of when a physical activity intervention may be used for pain management. Henry is a 92-year-old resident of a long-term care home. He has long-standing low back pain and intermittent abdominal pain. Although he is independently mobile with transfers and ambulation, he requires light assistance during dressing and grooming due to weakness and mobility restrictions. Henry has moderate dementia, and the clinical staff determines that he would benefit from general activity participation. The Public Health Agency of Canada recommends the following minimum amount of exercise for adults over the age of 65 in order to obtain the general health and well-being benefits of physical activity. Adults should participate in exercise at least 5 days per week at a moderate to vigorous intensity. The level of exercise that is considered moderate to vigorous differs between people depending on their fitness level and exercise tolerance. Exercise can be done in a single longer duration bout or spaced out over the day in shorter 10-minute bouts for a total weekly accumulation of at least 150 minutes per week. Strengthening exercises should be done at least 2 times per week, and balance and flexibility exercises should be done regularly to reduce the risk of falling. For our case example, Henry joins a group of other residents for the daily activity program that is organized by a physical therapist or recreation therapist at the long-term care home. On Monday and Friday, the group walks at a pace and distance that is comfortable for each resident, aiming to achieve a moderate to vigorous level of intensity. That means that the individual's heart rate and breathing rate are elevated, but talking during the activity is still possible. The residents start with a 10-minute warm-up of arm movements, marching on the spot, and gentle leg movements. This is followed by 15 to 20 minutes of walking, followed by a 5-minute cool-down. The total time for the exercises is 30 to 35 minutes. On Tuesday and Thursday, the residents join in the activity room for a stretch, strength, and balance class that includes 10 minutes of stretching for warm-up, 15 minutes of strengthening exercises using light weights and therapy bands, as well as balance exercises. This is followed by a 5-minute cool-down. On Wednesdays, a Tai Chi instructor from the community comes to the home to hold a beginner Tai Chi class. Saturday and Sunday, residents are encouraged to participate in their own preferred exercises. Adults who have not been previously physically active will need to gradually build up to these levels over several weeks or months. Those with unstable medical conditions may have contraindications to exercise. In addition, some older adults with an increased falls risk may require supervision or assistance with their exercises to ensure that they are safe. Some people with long-standing pain, particularly those with pain amplification syndromes, may experience a short-term increase in their pain while they are exercising. However, this should not be more than a mild increase, nor should it last more than 1 hour after the exercises stop. If new pains develop during the exercises, the older adult should be evaluated to determine why and if the exercises should be modified so they do not cause discomfort. To summarize, physical treatments include both active and passive interventions. Passive interventions, such as ice packs or TENS, generally have only a short duration of effect, but they may temporarily reduce pain, giving the older adult enough relief to allow for greater engagement in active strategies.